Welcome to the Global Child Nutrition Foundation's webinar on safely getting food to school-aged children and their families during the COVID crisis. This is the first in GCNF's new series, and we're thrilled to have such a strong response from the community. We've had over 300 registrants from all around the world, and we know that you're logging on as we speak. We're thankful to have you joining us, and we hope that you'll join the future webinars as well and share this information with contents who might be interested or might need it, colleagues who might be interested. My name is Alicia Miller. I'll be moderating today. I've been a longtime supporter and advisor to GCNF, and I feel really honored to facilitate this conversation with such an esteemed group. To remind you of today's overall agenda, you'll first be hearing from Rebecca Steelman, who's at GCNF. She'll provide an overview of the organization's support and the network that they manage with practitioners and how they're responding in the COVID-19 era. After her, you'll hear short presentations from our presenters. First, Carmen Babineaux, Director of the School Meals Division at the UN World Food Program, followed by Rafael Braga, Director of Food for Development at Tetra Laval. Next, we'll have Daniel Mamouni, Country Director, Sierra Leone at Catholic Relief Services. And finally, Cindy Long, Deputy Administrator, Child Nutrition Programs, Food and Nutrition Service at the US Department of Agriculture. I'll be reading brief biographies for each speaker at the beginning of their presentations, but I'll also remind you to visit GCNF's website if you want to review their expertise or find their full bios. And we will be taking questions throughout the webinar using the chat feature. For those of you who aren't familiar, there's a chat button sort of at the center of your screen that you can click on. Rebecca and others at GCNF will be monitoring those questions as they come in, and will be sharing them with me as the moderator. We're expecting we may not be able to answer all the questions today on the call given the limited time, so GCNF and the participants on the call will do their best to provide information afterwards if there's not enough time to answer your question, especially if it's critical and you really need an answer. Some of the speakers and GCNF will be promoting this event on Twitter during the event, but also after the webinar. We want to make sure that we get this content out. So I'll be sharing some of their social media information during the event. And you can also follow along there after the event ends. The event is currently expected to run 1 hour and 15 minutes. We will do our best to stay in that time, but we understand the conversation may extend a little bit if engagement is high and people can stay on. And there will also be an opportunity to continue the conversation on Facebook, and Rebecca will provide us more information on that closer to the end of the call. So I'm going to turn the floor over first to Rebecca Steelman, who is GCNF's Communications and Development Officer. But before I do, I also just want to encourage those of you who are interested in the Facebook group, possibly to join it while you're on the call. The Global School Meal Exchange is hosted by GCNF. You can find it there, and they'll be sharing other activities that GCNF is doing in addition to the overflow from this call. So Rebecca, over to you.
Thanks so much, Alicia. Really appreciate you moderating for us today. GCNF has a long history of supporting the school feeding community by building the capacity of governments to implement national school meal programs, sharing best practices and tools to support the creation, the expansion, and the improvement of national school meal programs around the world. As COVID-19 outbreak continues to evolve, GCNF is dedicated to supporting our partners who are working to adapt their school feeding programs during school closures. To do this, GCNF is first conducting outreach to our governments and their implementing partners to identify current trends, models, and best practices for school meal operation during the outbreak. GCNF is deeply grateful to our partners who have responded to the survey, many of whom I know are joining this webinar today. Your quick and detailed responses helped GCNF and our partners begin to identify areas of urgent need and opportunities for the network to support you. We are developing targeted projects with our partners in order to strengthen the global food system to address the needs of children and their families. We are proud to announce a new partnership between GCNF and the Global Food Banking Network that will provide technical support to food banking organizations in more than 40 countries that are on the front lines of fighting the food insecurity and hunger now accompanying COVID-19 health emergency, including food access to vulnerable children. If there are ways that GCNF or our network can support your work feeding children, please let us know. One of the things that we're offering is digital engagement opportunities while we can't be together in person. Via this webinar series, the Education and Nutrition, Reaching Children During the COVID-19 Pandemic, via our online resource hub that includes best practices, guidelines, and more, and online networking via the GCNF School Meals Facebook exchange group that Alicia mentioned. This is a great way for you to connect to folks that you might be meeting at the forum and are missing throughout the rest of the year. This exchange group is a great way to kind of get in touch with those folks, learn what people are doing in a real-time manner. Highly encourage you to join it. I think it's a great conversation piece for us all. As I said, we are here to support and bolster the work of our partners. So if you have a need that GCNF can fill, or if there's a way that our network could be helpful to you, please let us know. We are here to ensure all children around the world have access to safe, nutritious food now and well into the future. So please let us know how we can help you achieve that goal. Thanks so much, and I hope you enjoy the webinar today.
Great. Thanks, Rebecca. We appreciate that. Well, without further ado, I think we should get the panel underway, and we're going to kick off with Carmen Babineaux. Just to give you a bit of background on Carmen, Carmen is the Director of School Meals Division at the UN World Food Program. She has a very expert background in this topic. She has over 14 years of experience with the World Food Program, specializing in supporting governments to strengthen their national social protection and safety net policies and programs. She's served in posts in Peru, Rome, Colombia, Ethiopia, Kenya, Malawi, Tanzania, provided support across a range of efforts, including Haiti and Nepal. And she's also an author on a number of important publications in the school meals space, which you can find if you search her name, including Reimagining School Feeding, a Human Capital Investment in School Health, Education, Social Protection, and Agriculture from 2018. There's a whole list of publications you can find, and we're thrilled to have Carmen here. Carmen, over to you.
Thank you so much, Alicia, and thank you to GCNF, first of all, for organizing this this really interesting webinar and for inviting us to participate. I'm sharing my screen. Can you see it?
Yes, we can see it.
Okay. I don't know if I can make this bigger, but is that okay? Can you're fine with that right now, yeah? Okay. So thank you so much for inviting the World Food Program to participate. What I wanted to do with this presentation is give a broad view of what we are seeing in terms of the effects of the COVID crisis on school children. As soon as the crisis erupted in late February, early March, and school systems started shutting down, it became quite clear very, very quickly to WFP that school children and their access to meals was going to be impacted. So we started keeping track. We started an online map, which you can find in our website, and started to understand that the massive impact was really unprecedented. This is our current estimation of the number of children affected by the closure of schools in terms of their access to meals. You have on the left-hand side the number of countries that have school closures. This is thanks to UNESCO monitoring, and the estimated number of children that are currently missing out on school meals worldwide. Just by looking at the map, you can see that the impact is really global. It doesn't really distinguish between high-income countries, low-income countries, middle-income countries, because school closures have been quite a generalized response to the crisis. And so we have many, many children in most of the countries that are affected. In blue, you have the number of countries that WFP supports that are affected with school closures, and also 12 million children that are currently not receiving or that don't have access to the normal WFP school feeding operations. You have in the map the blue dots there also signaling where the WFP operations are being impacted at the moment. And we let's say we've been keeping track of the problem. This is the map of the problem, but we've also been keeping track of the solutions. And so you can also find on our website this second map, which is really impressive in terms of how quickly governments mobilized with other partners, with WFP, with NGOs, with other UN agencies to really find alternative solutions to the school closures and ensure that children continue to receive that support even though they were physically not in school. So you can see right now, according to our tracking, we have around 70 countries that have found alternative solutions. And the most common solution to this problem at the moment is take-home rations. So what we're seeing is governments or implementing partners pre-packaging the food and distributing it either to the houses of children or through schools, using schools as distribution mechanisms to make sure that these families and the children continue to be supported. Another very common element of support is converting these programs into cash transfers. We know of at least 10 countries that have done that. And then we have countries like the US, like some countries in Europe, Spain, et cetera, that are really implementing various modalities across the country. Really a varied response. Now we're particularly impressed by the quick reaction of governments in Africa and in Latin America, the leadership that they have shown in terms of their the flexibility of the programs are also a really important conclusion of this crisis for us, which we also saw in 2009 with the food and fuel crisis, and that is that school feeding really is the most robust and the most widespread safety net around the world that can be very innovatively and creatively used in response to shocks like this one, or like a financial shock like what happened in 2009. And again, we're seeing this year in this pandemic, school feeding really being used as a platform for governments to respond to the needs of those children that are so affected, but also to families. So for example, in Cambodia, we know that aside from the take-home rations that the children are getting that correspond to what they should have been eating at school, families are getting an additional ration to compensate for socioeconomic, basically the economic impacts of the crisis. And so that's what we see also is school feeding being used as a really broad safety net platform. What are we seeing in terms of measures, alternatives? What is this looking like? We wanted to share with you what the international community has been doing. The World Food Programme has been working with partners like FAO, like UNICEF, like UNESCO, and quickly mobilized a coalition of support for governments and for partners. So we've issued guidance for WFP operations, making sure that our own operations are safe and that we're not adding to the risk of children and their families in terms of hygiene and how to make sure that these distributions are properly done. But most importantly, perhaps for this audience, are the second three. We have issued joint guidance with FAO and UNICEF on how to mitigate the effects of school children on the COVID crisis, specifically about these alternatives to school meals and what to keep in mind during the crisis. The International Stand Committee, ISC, has also issued guidance on prevention and control in schools for COVID-19. And finally, something that was launched last week between WFP, UNICEF, UNESCO, and the World Bank is a framework for the safe reopening of schools, which we know now, especially in Europe, is something that is very much being discussed, and that will start to be discussed in low-income countries and middle-income countries as the crisis unfolds. So this framework is very useful to help governments and partners really think through some of the considerations once those schools start to reopen. And of course, it includes the consideration of school feeding and school health and nutrition. Some examples, as I was mentioning, of alternatives to school meals. And here we have some really interesting stories that are coming out from countries. You have here on the picture a teacher from Honduras. In Honduras, we have a really interesting story where teachers are getting on their bicycles, on their motorcycles, on their scooters, and they are going to distribute the food directly to children's houses. In their activity, and they're doing that, they are checking up on children and their families, understanding what their situation is at the moment, but also they have a chance to distribute materials in terms of COVID prevention and awareness, health messages, etc. We know that in other countries, like in Costa Rica, in many countries in Latin America, but some countries in Africa as well, are using the school feeding platform also to distribute textbooks and other types of material to children in their houses. So again, this sort of platform that allows us to support children even while they're home has been a very important and salient aspect of the response to the crisis. Let me just move to one really important partnership. I had mentioned what we're doing with FAO, what we're doing with UNESCO, but I just want to highlight here something that launched last week. within the UNESCO-led Global Coalition on Education. The World Food Program and UNICEF teamed up last week to really ensure and come up with an initiative to support the health and nutrition of children in schools. So we are going to be working with governments all around the world to make sure that those 370 million children are taken care of. And this is, of course, a very broad call to action, including high-income countries, middle-income countries, and low-income countries, to make sure that these children are not forgotten and that their needs are supported. We're also actively in the different countries working with ministers of education and with technical teams on the ground and partners to find solutions within education sector groups and clusters, to find solutions in terms of how to support children now. And we've decided to do a bit of a deep dive, a focused support and operational scale-up in 30 countries that have been identified as the most fragile. We've identified 10 million children in those countries that really depend on the meals. And here we're talking about children whose meal, the only meal a day is probably the one that they received in school, the most vulnerable children in the world. So we have scaled up this initiative. We aim to reach those 10 million children in the next few months. And one of the big things is gearing up towards a back to school campaign once schools are back in session. We are very worried and concerned that when schools reopen, we're going to start to lose an enormous amount of children that will just not come back. We know from Ebola and from other crises that when schools are open, it doesn't necessarily mean that the same amount of children are going to come back. The longer children stay out of school, the higher the likelihood is that they won't return. And that is true especially for girls, for children with disabilities, older children as well, that might be married off young or might be put to work by their households, etc. So packages that include school meals are going to be really important to ensure that those children actually do come back to school. And that's why our emphasis as the crisis unfolds and as it moves forward is really going to be about how to put in place a robust back to school campaign and back to school effort. And that's what we're going to be focusing on moving forward. I'm just going to end it there and say that if you're listening to us from a country and you're either in a Ministry of Education or an implementing partner in that country, please reach out to the WFP or the UNICEF country offices for support if you need it. They have both been really engaged with different partners at the country level, and I'm sure they would like to hear from you. And if you're a UN agency or an NGO partner or any type of partner from the private sector, et cetera, and want to join the WFP UNICEF initiative, this is by no means an exclusive club. It really is two agencies just asking for partners to join us. So we are very interested in hearing from you so that we can continue to build this coalition. Thank you so much, Alicia. Over to you.
Great, thanks, Carmen. And because you were so efficient with time, I actually am going to take a liberty here and pose a question to you, even though we're mostly waiting for questions to the end. There was a quick question about how are complementary interventions like deworming being handled or perhaps paired with some of these new interventions. If you have any quick thoughts on that, I'd love to include that before we move to our next speaker.
In some of the countries, as I was mentioning, we and the governments and the partners are using school feeding as a platform. So in some countries, we know that children are receiving supplementation together with the meals and together in some cases with textbooks and things. So this is being sort of bundled up together. But I have to say it's not widespread. We are concerned, for example, that in India, something like 100 million children are not receiving deworming this year because of the closures of schools. So we are very, very worried about the other health and nutrition packages that are also being affected. We don't have as clear a map and numbers on the other elements of the school package as we have for meals, but that is something that we're working on with partners to get a complete picture as the crisis unfolds.
Great. Thank you for that, Carmen. And thanks for your presentation. Also, just a reminder for participants, you can find Carmen on Twitter at @BourbanoCarmen, and you can also follow WFP's updates on a range of issues, including school meals, at WFP, which is their core handle. Thanks again, Carmen. We'll come back to questions at the end of the presentation for all the panelists. And next, we will move on to Rafael Braga. So Rafael Braga is the Tetra Laval Food for Development Director. He's based in Stockholm, Sweden. In his role, he's responsible for leading the Global Food for Development team in providing value-added support and technical assistance to Tetra Pak's customers in collaboration with governments, NGOs, UN, and international development agencies with the objective of implementing sustainable school feeding and nutrition programs linked to local agricultural development. Rafael has a master's degree in international business administration from the Wayne Huizinga Business School at Nova Southeastern University and a BBA degree from Loyola University, New Orleans. He has spent more than 20 years of experience in international business development with a specialization in creating public-private partnerships to address food security and nutrition challenges. The company has a long history and tradition of active participation in the development of school feeding programs and sharing their experiences and best practices around the world. Today, more than 68 million children in 56 countries receive milk and other nutritious beverages in Tetra Pak packages at school. Rafael, we're pleased to have you here today, and I'll turn it over to you for questions, or for your presentation. Thanks in advance.
Thank you very much, Elisa. Before I begin, I would really like to give a special thanks to GCNF for taking this initiative and also for providing the opportunity for all of us to share our learnings and experiences in school feeding programs around the world during these difficult times. I would also like to recognize the work that our customers doing and really in collaboration with local authorities, NGOs, by implementing alternative and safe distribution solutions so that children can continue to receive nutrition despite all the school closures. And finally, I'd like to thank organizations such as the WFP, CRS, USDA, and the FAO for proactively sharing important data and examples of the work that they are doing as well. I'll first start off with a brief introduction about ourselves. The Tetra Laval group consists of 3 industry groups. They are Tetra Pak, Sidel, and DeLaval. I'll focus on technologies for the efficient production, processing, and packaging of food. Thus, we cover the entire food value chain. As Alicia mentioned, we have a very long history and tradition of school feeding, particularly Tetra Pak, who has been working and supporting our customers, working in collaboration with governments, NGOs, UN, and international aid agencies in the development of school feeding programs that are linked to local agricultural development. And today, we are participating in 56 countries where 68 million children receive milk or other nutritious beverages in Tetra Pak packages in their schools. Our vision is that we commit to making food safe and available everywhere. Our brand promise is protects what's good. Our vision is really what defines our purpose and what has driven our work in school feeding and nutrition programs throughout the years. Our focus is really on food safety. We provide technical assistance and share best practices used in school feeding programs around the world with our customers and partners. For example, we have a senior school feeding specialist pictured here. He has more experience now in providing technical assistance and training in 42 countries. We cover a wide range of topics and we provide practical on-the-ground support covering areas from distribution, food safety, administrative setup of programs, school selection and preparation, and consumption protocols and evaluation. Now, having worked in many countries around the world, we realize that there are already existing infrastructure challenges in delivering food to schools. We have seen where there's already a lack of access to electricity or inconsistent supply. Schools will have no kitchens to prepare the school meals, lack of potable water, efficient infrastructure, or lack of roads that require other means of delivery by air or by water. Then you have seasonal challenges such as flooding during the rainy season. And now we have a COVID-19, which adds a totally new challenge that we haven't faced before. So in that sense, food safety plays an even more important role and critical role in the distribution of food safely. Now, I'll go on to share some examples and alternative innovative distribution solutions that are being implemented in some countries around the world. In China, for example, Tetra Pak has been actively working with their customers, the Ministry of Education and the Dairy Association of China to ensure the delivery of school milk. During the closures, there are a few methods in place. One where parents can go pick up the milk from schools. They also have online in non-contact delivery, so that the parents can provide all of their information from the child's school, their ID, the class, their contact number through an online ordering system. The milk is delivered through to these containers here, pictured here. The delivery person will deliver the milk to the containers. They will place the milk in the compartments. Then they have a password that they will provide to the parents by mobile. The parents can then go pick up the milk at the storage containers, and there's no contact throughout the whole process. Here is an example of the online order instructions that are being used for these home deliveries, or where parents input all of their data and information. We have also seen where our customers are making donations of UHT milk or long life milk to schools. They are also making donations of PPE, protective personal equipment, to the schools to ensure that everything is delivered safely. Another example is in the Dominican Republic. This is a national school feeding program where the Ministry of Education has implemented a system where parents can go pick up the food at schools. They have a breakfast program where they have UHT milk and biscuits. They have also designated a modality where there's a specific time that is assigned by school and by grade. The guidelines are that a maximum number of parents can go to the school at a time. They have social distancing guidelines as well, with lines no more than 10 people. Also, the schools they have hygiene protocols established for everyone. In El Salvador, the Ministry of Education is distributing the school milk through containment centers. They also have foods such as rice, beans, and cereal. They are prioritizing the most vulnerable communities at this time. They also have hygiene protocols and a verification process for the recipients. The parents can go then pick up the food at the containment centers. In India, India has the largest school feeding program in the world. The ingredients that are being used in the midday meal scheme are being delivered to children's homes instead of being cooked at schools, obviously, for the closures. And they have implemented a system where they have approved vendors to deliver the food. They're trying to expand the coverage at this time. It is a very large program. In Japan, we're seeing where they have a system where they have a school feeding program food service operators, and they are offering takeaway meals. They are marking down the prices at this time to support the families. The parents can go pick up the meals at the food service operator's location to provide their identity and all their contact information. The typical lunches include milk, rice, vegetables, and curry, for example. Then in New Zealand, we saw another example where the Eat My Lunch program is providing home deliveries of school lunches. They include a box of food items. They do weekly deliveries, and the food items include UHT milk, vegetables, bread, fruit, canned ham, and tuna. They have a buy one, give one model in place, which unfortunately they cannot continue due to lack of funding. So they are now in the process of looking for more funding to scale up this program so that children can continue to receive the home deliveries of the food. In Peru, we've seen a very interesting example of collaboration between the Ministry of Social Development and the Caliwarma school feeding program, where they are collaborating with the Air Force. And they are delivering food to school children in the Amazons. They have established bi-monthly deliveries, including pulses, rice, milk, oil, biscuits, fortified corn, quinoa, and kiwicha flour. The food items are then taken to the schools in the local communities and then picked up by the parents. In Paraguay, here's another example where the Ministry of Education and Sciences. They have prepared food kits with essential items used in the lunch program, which include UHT milk, rice, noodles, beans, salt, and flour and oil. They have a system where the parents will go to the schools with their ID and also with their child's ID. All the data is registered. There's control measures used to monitor, and hygiene protocols are being established as well. Moving along, in Russia, we see a similar model as in Paraguay, where essential food packets are delivered to the schools, and they are also picked up by the families. So in this case, you see some of the food items pictured here on the right include juice, milk, cereals, oil and flour, canned goods. These items are picked up by the parents, and with their information, the contact information, IDs, and so forth. And then they also have established safety and hygiene protocols as well. And finally, in South Africa, another very good example of collaboration, where the Department of Nutrition is coordinating with the Department of Disaster Relief, and they are delivering food via provincial nutrition centers. These are takeaway food parcels. You see that the districts are communicating the scheduled delivery days. They are also provided permits for the volunteers and the school staff mobilize, and also for the parents so they can be able to mobilize and pick up the food at school. And before I finish, I would like to take this moment to give a special thanks and recognition to our colleagues around the world who are really working around the clock and making a difference, supporting our customers to ensure that the food supply is maintained and that children can continue to receive safe nutrition during these very difficult times. Thank you very much.
Thanks so much, Rafael. That was a really rich presentation, lots of great content and examples there, and I know people are curious to learn more. We're already seeing some questions come in. Before I move to our next presenter, I do want to just actually correct myself. I told people to submit questions via chat, but if you would be so kind as to submit them via Q&A. I have seen the ones that were on the chat feature, but I meant Q&A. We will capture all of those and circle back with presenters at the end. So thank you again, Rafael, and we'll circle back with some of these questions after our next two presenters. So moving on to our next presenter, we have Daniel Mamouni. Daniel is currently the CRS Chief of Party for the USDA-funded McGovern-Dole Food for Education program in Sierra Leone, where he has worked since 2016 with CRS. Prior to coming to CRS, Daniel served as the West Africa Regional Director for Imperial College London, the Partnership for Child Development, and as an advisor for GCNF. Also, Daniel will have colleagues at Catholic Relief Services who will be participating on social media. So if you want to follow or tweet at CRS, you can use the handle @CatholicRelief. Daniel, we're thrilled to have you. Over to you. Not sure we can hear you yet.
Okay, can you hear me now?
There we go. Perfect, yep.
Okay, yeah, thank you very much, Alicia. And good morning, good afternoon, and good evening, wherever you may be across the globe. It's a real pleasure to be part of this very interesting panel to share what organizations and partners are doing across the globe in response to COVID-19. And as previous presenters have rightly indicated, when a crisis occurs, it's women, children, and particularly school children who suffer the most. And it's great to see all the efforts that our partners are doing to respond. And CRS is one of such partners. So today I'll be talking about the work that we're doing across the globe, and with a more narrow focus on the work that we're doing here in Sierra Leone in partnership with USDA to respond to COVID-19. But before I move on, I'd just like to share some information about CRS and who we are. As many of you may know, the Catholic Relief Services is one of the foremost humanitarian and development organizations in the world. We operate in 114 countries. We started off in 1943. We have various intervention programs across different sectors, including agriculture, education, health, and several others. And during this crisis, for example, we have developed strategies and response guidelines for each of these sectors. And education is one of the strongest pillars we're working around, and I'll be talking a bit about it. So in terms of our education portfolio, we operate primarily in Africa, in Latin America, and Asia. We have programming during emergencies and conflict. We have a food for education programming mainly funded by USDA. We have child literacy and development activities. Currently, we run about 9 McGovern-Dole programs. In total, we have about 66 education programs in 36 countries, 5 million people. We have a very comprehensive focus on delivering education interventions, and over the last between 2016 and 2018, and I present this data because we are still collating 2019 data. We have served communities and countries and governments to promote school enrollment. We've provided school feeding programs. We've provided teaching learning materials and provided training to teachers, all leading to the promotion of literacy rates. We've seen scores rising across different countries. But school feeding is really one of the important programs we run. We provide in-school meals to about 130 million children around the world. And what it means is that during crises like COVID-19, this intervention is significantly affected because when schools are closed, you're unable to deliver, and it requires adaptation of the strategy to ensure that these 130 million meals that we serve to children can be delivered in a safe manner during the crisis. And we have experiences from the devastating effect of crisis on school children, and especially on the household food insecurity and child nutrition and health. As many of you know, Sierra Leone suffered Ebola in 2014, 2015, which led to schools being closed for about 9 months. Schools were used as holding centers, so getting children back to school was difficult. Several hundreds of children, if not thousands, were impregnated and couldn't get back to school. And so during this time of emergency, our primary concern as an organization is really triggering the experiences from Ebola and seeing how we can work with national governments to address the challenges. And all across, we are hearing from, as Carmen rightly said, from governments that supporting the education sector, particularly household food security, is key. And this is what we did during Ebola, providing take-home rations to school children in spite of the challenge and the lockdown during the period. And COVID-19 is just a sharp reminder of the interventions we had at that time. And again, as I said, triggering our response to ensure that we can meet the food security needs of children during the school closure and lockdown period. We were very successful during Ebola, primarily because of the concept of partnerships. Partners came together to promote hand washing protocols, delivered school meals. At that time, CRS and WFP were the main partners working with the national government to deliver take-home rations to children. We had a radio programming that was supported by World Vision, IRC. We benefited a lot from the political will at that time, again, food assistance, and the issue of coordination was very key. Because as implementers, it's important that we have that level of coordination between ourselves, having clear standard operating procedures. And we're also very grateful for the partnership with USDA during that time to ensure that we could reprogram. Here we are again with COVID-19, and that's our Sierra Leonean locals who say corona and a bad sickness, which literally means, it's a terrible situation. And I need not mention the devastating effects of COVID-19. We're already seeing schools being used as holding centers. The government has triggered a lot of its Ebola mechanisms. The president is leading the initiative. We're currently at 230 cases and rising, but we know there are more community cases because of lack of testing. So what are we doing as CRS? This is us here with the Minister of Education. And when this crisis started, the ministry was really looking at how it could mobilize all partners around the table to see how we could address issues around the school closure, supporting continuous learning during this period, and also ensuring that during the crisis, school children do not suffer. And it is really important to understand that when we talk about hunger and its effects on education, it's not only the concept of food security. There are other issues like gender considerations. Just a couple of weeks ago, I was out in the field doing these THR activities, and a grandmother was offering her granddaughter to one of our drivers, to marry because of the fear of the current situation. And so how do we work together to ensure that during this crisis, we are cushioning families, households, to ensure that they are protected and that they can safely get back to school. And the school feeding program is one fundamental area of achieving this objective. So the government is taking lead. We've set up coordination mechanisms, and I just want to show how we're working here in Sierra Leone. The government has already set up several committees, working groups under the coordination of the strategic coordination of the Minister of Education. We have a communications working group, continuous learning working group, school reopening working group, and operations and planning working group. And school feeding is one of the key areas we are looking at as an organization working with the national government. And I just want to explain a bit of what we're doing as CRS. We have three major areas of approaching or intervening during this emergency. We have the prioritization of the well-being of the child, and this is where it also aligns with part of the government's working groups that have been formed. So here we are providing take-home rations and recognizing that we cannot deliver on-site feeding. We are converting what would have been given to the children during a regular school day into take-home rations so that they and their families can have food during this crisis. So we top it up a bit, but basically taking home the same food ration that they would have received over a 6-week period. And as the emergency continues, we continue to top it up. So we're looking at, during this time, we're looking at collecting data about the number of children in the schools, getting the rations done, working with transporters to send food across, which is a very difficult challenge because during the lockdowns, we have to receive special permission from the national government to be able to move from one district to the other, and also training our staff to be able to deliver the take-home ration. We're also working with the government to realize one of our own response strategy, which is ensuring continuity of learning, which also aligns very, very well with the national government's continuous distance education program. And here we're working to provide distance education. You can see from the pictures here, kids sitting around to listen to radio programming. So CRS is funding this in 2 districts, ensuring that kids can listen to broadcasts from the national capital during the lockdown period. With support of USDA, we are procuring radio transmitters to ensure that this can happen on a long-term basis. But in the interim, some community radio stations are being paid by the project to do that. And lastly is looking at the issue of supporting safe return and ensuring successful transition. And as Carmen rightly said, we don't just assume that all the kids will come back to school for various reasons. During the closure, if not managed properly, some girls will be married off. Some parents would even be nervous to bring their kids back because, as I said, schools are being used as holding centers. So how do we work to change mindsets and reassure parents and also protect girls during this emergency? And so we have the take-home rations, the the radio programming, the community hand washing initiatives, etc., to keep this going. And lastly, I just want to talk about some of the SOPs we are adopting. We've developed very clear guidelines to ensure that both our staff and communities and partners are protected as we embark on this initiative. Some of them we develop internally, and others we rely on some of the global protocols as described by Carmen in her presentation, looking at issues around social distancing, looking at issues of the data so that we are really reaching the number of schools and the number of children, promoting hand washing. This is the Minister of Education washing his hands as he approaches our CRS warehouse to inspect our feeding program. And just lastly, to say that in all of this, messaging is very, very important as well. During this time, many people are nervous to engage because of the threats of the virus. And I just want to use this opportunity, if all implementers in the field are listening. I know we have colleagues from all across the world embarking on this exercise, that just as we commend the healthcare workers, our frontline workers who ensure that we can deliver these take-home rations are doing a phenomenal job. And we want to demonstrate as we embark on this that, even though we might be separated by the 2 meters recommended, for social distances, we are all in this together. So thank you very much, and I look forward to receiving your questions and discussions. Thanks. Over to you, Alicia.
Thank you, Daniel. That was a great presentation, and you reminded us of a lot of important pieces of the conversation, including gender and how this is impacting people differently and well beyond food or health as well. We're getting lots of questions coming in here, so I'll circle back on those when we get to the Q&A session in a moment. And just to thank our participants, I am seeing your questions in the Q&A, and I will address one important question that's come up already a few times, which is about sharing the presentation materials. We will be sharing a recording of this webinar and copies of the presentations with you afterwards, and they'll also be made available on GCNF's website. So for those of you who are wanting to review these when you have a bit more time, you will have that opportunity, and it's coming up. So next we're going to hear from Cindy Long. Cindy is the Deputy Administrator of Child Nutrition Services, Food and Nutrition Service at the U.S. Department of Agriculture. She's responsible for all aspects of federal administration of the child nutrition programs, including the National School Lunch Program, School Breakfast Program, Child and Adult Care Food Program, Summer Food Service Program, and the Fresh Fruit and Vegetable Program. These programs provide over $20 billion in nutrition assistance to children and families. Cindy has been at the USDA since 1991. She brings a wealth of experience, and we have been seeing some questions that I think pertain directly to the US. So Cindy, it's a perfect moment for you to join us. Over to you.
Great, thanks very much, Alicia. It's really, I really appreciate the opportunity to be here this morning. I want to, first of all, thank the other panelists for the information they shared. It's great information. I think in a crisis as we are experiencing, the ability to share best practices information quickly is really essential. And I feel like I've already learned a lot this morning. I'd like to share my screen. I think I need to ask the previous presenter, Daniel, to stop sharing because it's not allowing me to do that. So I'll pause a minute. Okay, great. Thank you, Daniel. So I'm going to just take a few minutes to share some information about the U.S. response to the COVID pandemic. As you may know, the United States has a long-standing, highly structured school meals program, as well as other programs to support preschool and school-age children. The funding, the structure of the program, and the policy are established at the federal level. The states are responsible for the administration and oversight of the program, and then they're actually operated at the local school districts on a day-to-day basis. The COVID response in the United States really does build on the strengths of this structure and also responds to some of the challenges that this structure presents. Today, I'm going to briefly cover our response to the school feeding in the COVID-19 crisis. We can think of the U.S. response as falling into 3 categories. First is modifications to existing school programs. Secondly is the creation of new program options. And finally, the role of other nutrition assistance programs outside of the school meals programs. A really key aspect of the U.S. response to date has been engaging all stakeholders, including not only the federal, state, local government kind of entities, but also the private sector. As I've noted, these programs do really operate in a highly decentralized manner. And whatever success we've been able to have has been very much due to every player in the process adapting very quickly to new program options and circumstances, by modifying how they provide meals, by mobilizing the resources they have at the school and at the community level, and by learning from each other. The School Nutrition Professional Network in the United States has really done a remarkable job in sharing information and learning from one another, and in specifically using social media to do that. Before I get into the specific program descriptions, I should point out that most of the actions I'm about to describe are available because of action by the legislative branch. Because our programs are federal and they are established in federal law, significant changes to how these programs operate do require action by Congress. You may know that Congress has passed several very large, massive pieces of legislation that broadly address the COVID-19 crisis. Specifically, the Families First Coronavirus Response Act, which passed on March 19th, provided the basis for most of the child nutrition related activities that I'll be discussing today. And it also provided, importantly, a very substantial increase in funding for these programs. So I'm going to start with modifications to existing programs. All of our school meal programs in the US are based on the concept of congregate feeding. Children are served meals in a group setting at school. This is very deeply embedded in the statutory and regulatory structure of our program, but obviously this model does not work in a social distancing environment. It's not suited to that. So one of the critical early steps to the US response was to waive the range of requirements that were associated with this congregate feeding model. This allowed schools to operate pickup-based or home delivery models. In a pickup model, families can come to a distribution site and obtain meals for their children. We have allowed many flexibilities around this approach, including the provision of multiple meals per pickup. And we have also allowed, in certain circumstances with appropriate protections, adults to pick up meals for their children without actually bringing their children with them. All of these measures are allowed to allow for the safe provision of meals within a social distancing construct. Many school sites have been very innovative in structuring their pickups to minimize contact, including drive-up models. Other models have used school buses to deliver meals to students' homes or to drop them off at specified drop-off points in the community. These non-congregate feeding models are available nationwide. We've also worked with states to tailor state-specific flexibilities that address more specific circumstances. For example, in the way our programs are structured, in some cases, the availability of free meals is based on the proportion of low-income students in a community. If that reaches a critical level, then all meals can be provided for free. Recognizing that the economic circumstances of communities are changing rapidly under the current circumstances, and that available data might very well not reflect current circumstances, we have provided tailored waivers of these area eligibility requirements to allow states to expand the service of free meals in appropriate circumstances. We've also provided states with the ability to allow school districts flexibility regarding the meal pattern and nutrition requirements. States can approve meal pattern modifications by schools if they are needed to address specific circumstances where food items are not readily available due to some kind of disruption in the school's usual food supply chain. It's important to note that we do continue to encourage schools to come as close to the required nutrition standards as they possibly can. School meal professionals have done a great job of using the flexibilities I've just described to meet the needs in their community. I'm going to share a few photos of these, the dedicated staff serving meals in their communities. And these photos are from a middle school in San Antonio, Texas. This first slide shows school nutrition workers preparing meals for pickup. You can see that she's working in a social distancing structure. There's nobody around her. And then the photo of the bags that will be picked up gives you a sense of the kinds of items that are being provided. This particular picture looks like it contains 2 lunches. And as I said, they are allowed to provide multiple meals for one pickup. This slide shows an actual pickup, a drive-up pickup model, which is designed to minimize physical contact. As you can see, the car is just driving by and picking up the meal. In this particular case, it looks like the family has brought their children with them. as I did mention, parents are allowed to pick up meals without the children being present in some settings, if that's a better mechanism for promoting social distancing. And then these last two photos also show some other features that provide examples of how local schools are minimizing risk in the pickup process. In the first picture, you see that the way they're doing this is that the meals are being set out on a tray and kind of pushed over to where the driver can pick them up. And then the meals are placed on the trays to minimize hand-to-hand contact. And then, of course, they are cleaned between each pickup. However, it also became fairly clear early on in the US response that there were certain needs that simply could not be met even with these significant modifications to the existing programs. Some schools simply did not have the capacity to produce and distribute meals when they're closed. And these models can be challenging for rural areas. So I also wanted to share some additional options which have been created and implemented. Recognizing that these options wouldn't work for all communities or families, Congress did create a new program as part of the legislation that I mentioned that is called Pandemic EBT. This option allows states to provide benefits to families who have temporarily lost access to free and reduced price meals due to school closures, using the EBT system used by our SNAP or food stamp program. In this model, families receive cards with a dollar value that can be used for food purchases. The amount on the card is equivalent to the federal support that would be provided to schools for each student for a free lunch and free breakfast for each day that the school was closed. This program is available at a state's option, and there are currently about 20 states that have been approved to operate the program, and there are more that are in the pipeline that we expect to begin operating. Another option that is specifically targeted to rural communities is a public-private partnership that's known as Meals to You. This is a partnership between the USDA, Baylor University's Collaborative on Hunger and Poverty, McLean Global, and PepsiCo. So it's a public-private partnership. These partners are working together to provide weekly food boxes that contain 20 meals, 10 breakfasts and 10 lunches that are delivered to students at their homes to substitute for meals that they would otherwise receive at school. The boxes are delivered to the homes via the US Postal Service as well as other delivery services. Currently, this program option is operating in 12 states, and it's already shipped over 3.5 million meals to students. We are working with our partners to expand the program to additional states with a target of shipping 5 million meals. Finally, I do want to be clear that these efforts to provide continued support for those who rely on school meals does occur in the context of other efforts to support families during the COVID-19 public health emergency. We are fortunate in the US that we have a network of nutrition assistance programs. And these other programs that aren't specifically targeted at school-age children are also being modified to meet the current circumstances, as well as being the funding for some of these programs being substantially expanded. For example, our SNAP program is really the most broad-based nutrition program in the US and is kind of the backbone of nutrition assistance in this country. It provides financial support to low-income families to purchase food through an EBT system. Families receive benefits on a card for a dollar value that they can then use to purchase food. Some of the recent changes, adaptations to the SNAP program to meet current circumstances include an increase in the benefit level that's provided to some households, as well as the expansion of the availability of online purchasing through the SNAP program. And there have been a wide range of other measures to basically ease access to SNAP. I should also mention that Congress has also provided additional funding to USDA specifically to support the provision of food to food banks, and that we are also supporting state efforts to distribute foods directly to households using a similar model that is used in natural disasters. So we're building on a model that states and localities are also familiar with. So that was a very high level of how we're serving US school children during this crisis. Our website goes into far more detail on everything I mentioned if you're interested in more information. And at this point, I will turn it back over to Alicia for questions.
Great, thanks, Cindy. Since you have your screen open, I'm going to ask you a quick question and then I'll start going back through the rest of the group. We have a lot of questions, so I will try to direct them to each of the panelists individually. And so one for you that's quite specific. Will USDA continue the waiver for non-congregate dining during the summer months? This comes in from Ellie Lucas.
Yeah, this is a question we've gotten a lot. Unfortunately, I don't have a definitive answer to that. Certainly USDA is aware of the the concerns and the fact that folks are thinking forward to the summer, and we will be providing more guidance and information on that soon.
Great, thank you very much. Next, I'm going to go to Rafael. If all the speakers could kind of join us back by maybe keeping your microphone muted, but bringing your screen back, that'll allow us to maybe have a bit of a conversation, because some of these questions could be directed at multiple people. Rafael, I'm going to start with you. There's a question here. This is from an anonymous attendee. How is the food supply chain being maintained, and how is coordination working? In your work, what points in the food supply chain have been the most impacted by COVID-19?
Well, that's a great question. If you look at it through the food supply chain, if you look at it from the consumer side, first we saw a lot of panic buying that started going on. Then, the consumption habits really changed a lot from going from home consumption rather than the food service distribution modalities were heavily affected, and school feeding falls within that. Then, when the lockdowns and the permits to mobilize, I say restrictions to mobilize were implemented, you have to, the companies and the farmers and the whole, distribution network needs permits to mobilize. They need permits to operate. So there's a lot of coordination, and that has to be done with local authorities and do it very quickly. Then you have travel restrictions, of course. So when, for example, a food processing plant, a packaging plant needs technicians to travel and can't go, or needs some special service, they can't. So, then innovation kicks in, where you have to really support everyone through remote, in a remote way, So in this case, we have technicians, working around the clock, from in Sweden, supporting in Latin America or in Asia, Africa, and so forth. The team has done a really wonderful job. Then you have all the IT mechanisms behind everything, and then you have the disruptions within also the shipping of goods and services. A lot of people forget that commercial flights, for example, when they stopped the airlines stopped the travel and they had the lockdowns, a lot of parts and so forth are delivered through also on cargo on commercial flights. So that places another burden on delivering parts and making sure that maintenance can be done on a scheduled basis. Then you have the farmers need to mobilize. They need to continue working, keeping the delivering to the processing plants in a safe way. So there's a lot of coordination, a lot of communication going on, and so far, overall, I mean, everyone has done a fantastic job. It hasn't been easy, but the dedication from everyone has really been excellent, I think, overall.
Thank you for that. Carmen, I'm going to come over to you. There was a question since the schools were closed and children are facing acute hunger. What's the overall strategy for places that have low coverage of school meals?
Well, in Mozambique, we were, before the crisis, feeding around 230,000 children. So that's not a small program. It's actually quite a large one. And of course, now that the schools are closed, that program, as many others, has been affected. In Mozambique at the moment, and I checked because I saw the question just before you asked it, I checked with my team. What we know is that the WFP office is discussing with the government whether take-home rations or cash transfers might be the most appropriate modality. And I do want to say that in most of the countries, it's really a conversation between the government, the Minister of Education, the ministries, and WFP to look at what is the best modality for that country. Also, taking into consideration what are their safety nets are around and how do we ensure that these complement each other. So in some cases, take-home rations are the best modality. And as I was saying, most of the countries, especially in low-income settings, are choosing take-home rations as a modality. But it also It also depends on the country and on what the government is looking at in terms of an overall response. I have to say also that some countries, and this might be true, for example, for a solution to Mozambique and in other countries, the WFP office and the government are combining two solutions. So like in Armenia, the government and WFP have combined a take-home ration of food with a top-up of cash. And that is meant to support both the child, him or herself, but also support with an extra transfer to the family. In Cambodia, the child equivalent of the take-home ration is being repackaged to send to that family, but also an additional portion of food to compensate for the family itself. So in some countries, and I see some questions here about whether it's the child or whether it's a family ration, because we all know that the whole family is suffering, not just the child that was in school. And so in some countries, the government has requested WFP to look at family rations, not just child rations. And that's another element that we're looking at depending on the country. And as I was saying, really depending on what the government's response overall looks like, the other thing that we're doing is advocating for the families of school children to be included in beneficiary lists of other safety nets, like vouchers and cash transfers that might be distributed in that same country. So those are different mechanisms in which we're making sure with governments that those children are covered in one way or another by the safety net in that country.
Great, thank you. And that does speak to one of the other questions about reaching children that are out of school or not school age, kind of addressing that family. Yeah, thanks for that. Daniel, going to come over to you. We have a few questions that have been posed for you, and I think some of them you might be able to address a little more quickly, and others might take a bit. So I'm just going to pose you a couple. One is, are there plans to support local farmers who've been hit hard with local purchase as part of the school meals or other safety net programs that are purchasing food? A second question about how is the government contributing resources besides political will in Sierra Leone? And then a final question that I think would be helpful to hear, from your perspective, how can donors better support implementing organizations to adapt and implement differently during the crisis? Where are there opportunities for donors to work together in their response? So if you could just touch on the local purchase, a bit on government support, I think they're looking for resources there, and then speak to the donor piece, that would be great.
Yes. So yeah, thank you. It's, the first one is it's a bit of a tricky one because, in some countries they're implementing homegrown school feeding solutions, and in others they are not. Unfortunately, in Sierra Leone, we're still working towards the realization of homegrown school feeding. But I think in other countries, there's a real opportunity for governments to provide support for local purchase, supporting local farm, especially where they have an organized system. It's more difficult when the system is not very organized, but if there's an organized system that is already functioning, it is easy for procurement to happen. So definitely there's an opportunity, depending on the country context and the level of organization. Because during emergencies, you've got two things happening. One, the government may think of very creative solutions to local solutions, or that they may be focused on other aspects of the emergency, especially the health aspect, because usually that's what happens. There's more focus on the health aspect than the agriculture and food security part. So where the system is organized, Ministries of Agriculture definitely has an opportunity to support, especially when there's a stable market, because it's also the issue of what the procurement will be used for. So institutional markets like school feeding definitely provides an additional incentive for this engagement of local farmers. In terms of how governments are contributing to the resources, again, it depends on the level of development in the country or the economic circumstances of the country. In the case of Sierra Leone, there's a huge demand for resources because of all the multiple demands at the moment. So they are relying mainly on donor partners, and that is why they've set up the coordinating system where they can bring together all the donor resources. And in other countries, like in a bit more advanced countries, maybe in cases like Nigeria and Ghana, etc., we're seeing that the national government is, procuring food and doing their own distributions as part of the emergency program, especially where they have a strategic grain reserve or buffer stocks. It makes it easy for the government to chip in. So again, it just depends on the level of development of the country and how the government resources can be rechanneled to supporting the emergencies. In terms of donor support, I think we are very fortunate in our case to have a donor that is very responsive, and that is USDA, because in times like this, it is, the biggest support implementers can get from donors is approvals for adaptations. When we plan programs, we do not envisage crisis like this. But when the crisis happen, how do we quickly adapt and get the necessary approvals to respond? And I think besides, of course, the quest for additional resources, for example, for USDA, if we could get more commodities, that would have been excellent. But in the absence of that, just allowing us to reprogram, to focus resources, the existing resources on critical areas like take-home rations instead of on-site feeding, and also looking at other areas like radio programming or other online distance learning opportunities is a great relief. In our case, we got approval for radio programming from USD in like 12 hours, and that was quite phenomenal. So, besides additional resource contribution, getting these approvals in quickly will be helpful. And lastly, having interagency coordination. And again, this is where some countries are doing very well. In Sierra Leone, we have UNICEF, European Union, WFP, all the key players, CRS, coming around the table to discuss what resources we have and who plays what role. And it's all coordinated by the government. Yeah, thank you.
Thanks, Daniel. Thank you. I just want to, before I pose my next question, which I'll bring to you, Cindy, just want to acknowledge we have about 20 questions. I also realize we're at 15 after, which was the sort of planned end of this. We're going to keep going for a little while longer, maybe up until the half hour. I am seeing some drop in participation because people probably have other meetings. But I do want to try to get in one or two more questions before we drop off. We see them. You can continue the conversation later on Facebook. GCNF will make an effort to get answers to these questions for those of you who are asking also. So Cindy, over to you. There's two questions I'd like to pose to you here. One is related to school milk. So Catherine Bertini asks, what happened to school milk distribution within school lunches? There are a lot of creative food distributions going on, but not necessarily with milk. Dairy farmers are dumping milk for lack of institutional buyers. Can USDA do more about that? So we did see dairy in some of the school meal packages excuse me, that you showed, but we'd love to hear more about that because obviously it's been in the news. People are seeing that. And related to the news, there's a second question from Kara Myers. She says, the real question is the US school meals program response working? Yesterday, the New York Times published an article that reported 1 in 5 children were not getting enough to eat. So can you address this concern? Thanks.
Sure. To start with the first question, as you mentioned, Alicia, the models that are doing school pickups or the delivery models in general are still sticking with the school meal standards. There is some flexibility if schools can't get the products, but the preferred and I think the most common scenario is they are trying to provide all the components, so they are providing milk. Certainly, we're all aware in the U.S. of the stories about maybe the challenges from getting products such as milk from the producers into the supply chain. There are other efforts at USDA that are happening sort of beyond my bailiwick of the feeding programs to try to address that. About a week and a half ago, the USDA did announce a large program that was designed to try to connect producers directly with distributors to try to address some of these issues that we're hearing about product existing but not having a way to get into the market or to those in need. With respect to the second question about basically are we reaching, how are we making sure that we are reaching all children? I think our best shot at doing that is to continue to emphasize this multimodal response, which I sort of outlined at a high level in my comments. We certainly saw, I think, at the beginning of the crisis, a real focus on these school pickup and delivery models. But as I said, there are other options out there. We do have the model where the EBT cards can be provided to families to replace the school meals programs. Many of those programs are just getting started. And they, in theory, have the ability to provide benefits to every child who depended on free and reduced price meals. We do have the other programs available in the US that have been expanded significantly as well, the SNAP program, and some of our programs that, as I said, that provide commodities directly, either through food banks or in some cases through local nonprofits that are provided directly to households. You know, the scale of the need is certainly large and is changing rapidly. But we, you know, I do expect that USDA will continue to sort of keep the focus on this multimodal approach to make sure we're doing everything we can to meet the need.
Thank you for that. Just to give our speakers kind of a heads up, with our remaining 10 minutes or so, I'm going to go try to do one more question here for those who've had just one question. So Rafael, I'll be turning to you. Daniel, I'll turn to you next. And then if we have time, I'm gonna hit one more question for each of Carmen and Cindy. And then I'll turn it back over to Rebecca. And as I said, if we don't answer questions, we will try to do so in the time after the presentation. Rafael, there's a question here for you. Can you talk about how many children the programs you discussed are actually reaching? How many children? If you have a number or some sense of the scale, Kara was interested in that. And then also a question here, I wanted to make sure. There was a question that came up around the time you were speaking, so I think it was posed to you, about how these innovations might be changing the cost of delivering these foods. Those would be the two that I think, I'm just double checking if there are any other questions that are kind of pressing. So if you want to get started on that, I'll see if there's another one here that I missed.
Yeah, first of all, we're involved in 56 countries, and 68 million children receive school meals, or mostly milk or other nutritious beverages in Tetra Pak packages. It's hard to tell. I mean, there's a lot of countries that have been affected. We do an analysis on the amount of children covered every year. Right now, there's a lot of countries starting to pick up and implementing the programs. The national programs, we see they're not fully implemented for logistic reasons and other variables. So we don't have an exact number of exactly right now of how many are being affected. But I think, as Carmen alluded to her presentation, there are a lot of countries right now that aren't able to deliver. Having said that, it will be very, very interesting to see how the distribution changes with all the stay-at-home orders. So we're seeing an increase in home consumption, right? So children are still getting nutrition, but we don't know if there's some correlation related to school feeding or not. And that will vary from country to country. But I think, right now our main priority is to make sure that the food supply is maintained, and those countries where they're starting to, we can support our customers and support everyone to do that. I think we'll have time to do the analysis after that. Right now we're, on kind of emergency mode, supporting as much as we can, and we're prioritizing our focus on that.
Thanks very much. Appreciate that. I'm going to go back over to Daniel. Daniel, there were a couple of questions here. I'm just double checking. Sorry, folks, for this. There's so many. I'm trying to make sure I actually capture them. Let's see. So Louise Iverson says, such great efforts highlighted here, mostly that leverage existing modalities via national school lunch programs. What are we seeing in countries? Excuse me. This is for GCNF. In fact, Daniel, I'm going to hold that one. This is related to Canada, so we're going to hold on that one for a moment. My apologies. There are questions here about children who are non-school age, and I wonder if you could speak to that specifically in Sierra Leone, how CRS or other partners are addressing non-school age children.
Okay, so yeah, it's an interesting question, because we, in our programming, we tend to actually unintentionally target children who are not school age, in the sense that when you visit most of our communities, especially in grade 1, you find a lot of underage children because of the food incentive. And also in many of those communities, they have, in some of the communities, they have ECD centers. So where they exist, we provide, either on-site, school feeding during regular times, or they're included in the take-home ration during times of emergency, as described. But if they're not part of the school system, that is, if they're not either in the ECD centers or enrolled in primary 1, irrespective of their age, then they tend to be out of the scope, and that is just by nature of the design of the intervention. During emergencies, you would want to address every need, including out of age, underage children or out of school children. But the truth is that we're also limited by what we're able to do. And in this case, if they are not part of the regular school system, they are not included. Regardless, let me just point out that from our experience, even though not ideal, these take-home rations do affect everybody in the household, even if it is just a ration for this individual school child. And in most cases, you may have 2 or 3 kids per household in a school, and each of them receives take-home. In the end, it benefits the entire household. So we may not be addressing all the issues altogether, but we're at least contributing where we can to address food security needs. Yeah.
Thanks, Daniel. And thanks for answering that question. I think asking about kids who are out of the school age, including preschool kids, is kind of an interesting question that's often doesn't have a home in terms of a program that serves them all the time. I'm being told by our GCNF colleagues that I need to wrap up. So I'm going to give our presenters here one last moment. Carmen, Cindy, Rafael, anything else you want to say here before I turn it back over to Rebecca? Any last words? Carmen, go ahead and go first if you have anything you want to add.
Thank you so much. Just maybe to thank GCNF again for this wonderful initiative, and say that what we really appreciate all the enthusiasm, the questions that have been raised. It is for us a priority right now to look at how we can continue to support school children that are really being massively affected during this crisis. It also presents us with an interesting opportunity, I would say. First, about looking creatively on what kind of support do we need to provide to children during this period, how can we do it more effectively, and coming up with alternative mechanisms that might even be spurring us into innovations that we didn't even imagine. So looking at this also as a possible opportunity to innovate through, for example, WFP is scaling up digital tracking systems to make sure that the food is actually getting to the children, making sure that we're monitoring the feeding, etc. But through digital systems that have been ramped up, let's say, or sped up in their development. They should have been done next year, and now we're really speeding them up this year for the crisis. So that's also, I think, an opportunity for innovation, for engaging. The private sector has, of course, become a really important partner for us in all of this, but implementing partners throughout the world. So just to say, we are facing large challenges. We have an enormous population that's massively affected, but also an opportunity here to think differently outside of the box and maybe come back with programs that are even more efficient than before.
Thanks, Carmen. Appreciate that. And Rafael, maybe over to you. Any last words?
Yeah, thank you. And I'd like to give a special thanks to GCNF once again. I'd like to talk about the importance of collaboration. During these times and during normal times, sort of say, collaboration is extremely important. And then when you go into an emergency situation, you have to do it at such a fast pace and coordinate in such a fast pace. So that those existing collaboration between all stakeholders involved is so important because we're really fighting against time. So the more effective you are at being able to distribute the food to the kids and looking for alternative ways, innovative ways, you know, it's great. And I think we're going to have a lot of learnings from this overall. We're really transforming the way we work, and I think, like Carmen said, you know, it's going to make us better in the future.
Thank you. Cindy, over to you. Last words.
Yeah, thank you. Again, I also want to thank GCNF for hosting today's webinar. And I want to circle back to Carmen's comments about innovation, and just, I think it is so important to always, for all of us who are engaged in school feeding, to be thinking innovatively, looking beyond what we're currently doing now and what we can do next. I think two of the things that have been so important in the US, the Meals to You, the program where we're sending boxes home, as well as the pandemic EBT card, where we're replacing the school benefits with an EBT card. Those were both tested in a very small scale way as demonstration projects before this crisis. And having done that really provided us the ability to think about them and scale them up dramatically very quickly. And we couldn't have, I don't know that we could have done that without, absent some folks thinking innovatively and getting the demos off the ground a couple of years ago. So appreciate those comments by Carmen. Thank you.
And Daniel, the fair moderator, and me can't end without giving you a last word. Anything quickly?
Sure, I'll keep it very brief. I mean, I think again, thank you to GCNF for organizing this, and also to all those who've attended and asked questions. I think this is a really exciting opportunity for us to come together to see how we respond to this current emergency. And you know, as unfortunate as it is, emergencies will keep happening. You know, that's what we've come to understand in our world. And so for me, it's also looking at how we document some of the lessons we're learning, the new ways of doing things, and ensuring that, you know, we can translate some of the, you know, positives in preparation for new emergencies in future. And during this time, resources are limited. And so just to re-echo the issue of partnership and collaboration, as Rafael mentioned, no single organization can do it all by itself. And so let's work together and let's get it done. Thank you very much.
Thanks, Daniel. I'm going to go ahead and turn it back over to Rebecca at GCNF and thank all of the panelists for bearing with me on my first webinar. And you've all been wonderful. So over to you, Rebecca at GCNF.
Thanks, Alicia, and thank you so much to all of the panelists that joined us today and all of the participants that were able to join us from around the world. I know some of you have had to drop off, but please look forward to receiving some of these materials in your email in the coming days. The presentations along with this recorded webinar will be emailed to you shortly. You can also find them on our website at gcnf.org/COVID/webinars, along with information about our upcoming webinars. The next in the series will probably be held the 3rd or 4th week of May. We're still ironing out some details with our speakers, but we're looking forward to seeing you again there. In the meantime, please feel free to continue this conversation in this Facebook exchange group that we've mentioned. It's the GCNF School Meals Exchange Group. It is a group for folks to talk about school feeding throughout the year. So it's great for this meeting, but also for other days as well. If you have questions for your peers, please look to that group as a resource for you. And again, finally, just one last plug for GCNF's resources on our website. If you're an organization that is working in COVID and school feeding and you have resources to share with a global network, we would love to be a place to host that material. So please get in touch with me at rebecca@gcnf.org if you'd like to share any of those materials. Thank you all so much again for joining us today, and we hope you have a lovely afternoon, morning, whatever you're looking forward to. Thanks so much.
Thank you.